Good afternoon and good morning, everybody. This is Amanda Pierce-Kelly, National Advocacy Director at NAC. We are so glad to have you join us. There are a lot of updates for you today and some really important action steps that will help you focus on in terms of advocacy. So I am happy to be joined by the advocacy team and the federal affairs team to walk you all through the presentation today. Just before we get started, just a little bit of housekeeping. We encourage everyone to listen to the webinar today using their computer, and so because of the way WebEx operates, accessing your audio via your computer is absolutely the best way to listen in on the conversation. So hopefully you all are hearing us loud and clear already, but for those of you that are working on trying to tap into the audio, please do so following the instructions and using your computer. The webinar is being recorded. We do that every time, and we make them available to access the slides and the recording on the Health Center Advocacy Network website. You can see the address there. Typically, this is something that we make available within 24, 48 hours, sometimes a little bit longer, just depends on the backlog of what we're waiting on. We also distribute that via the Washington Update, so look for both the link and the updates coming to you soon on that side through the Washington Update. And then, of course, you can always go to the Health Center Advocacy Network website, hcadvocacy.org, and access the slides and the recording under past events. If you have questions at any time during the webinar today, you can enter them into the chat box. That's the best way to make sure that we take your questions up. We'll make sure to leave some time at the end to get through as many questions as we can. And occasionally where we're able to, we'll actually take those up in real time. So again, if you've got any questions, you can pose to the entire set of panelists or to an individual, but you want to use the chat box to do that, and we will be taking those up as many as we can at the end of the discussion. So in terms of what we're going to cover today, we definitely want to get everybody up to speed on everything that's happened since our last webinar. And of course, we postponed the originally scheduled webinar, which was last week, due to a lot of activity and changes in Congress, which occurred end of last week. And so the good news is that we have the very latest information, including some of the changes that we saw end of the week last week. So thank you for those of you that were able to act quickly and join us today. So we'll walk through what we've had occur since the last webinar. In particular, we want to talk with you all about the primary care funding cliff, workforce, and updates on 340B, and exactly what went on in the Senate last week. And then from there, we'll transition into a conversation about what advocacy items you all should be focused on headed into the August recess, the resources we've created to support you in doing that, and why engaging in advocacy, particularly in the next few weeks, is going to be so important. So with that, I am going to turn it over to the Federal Affairs team. I believe John Sawyer is going to kick us off to walk us through the policy update.
Thank you so much, Amanda, and thank you to everyone who was on the call. I just want to echo Amanda's sentiments and thank folks for being flexible with us. I think had we gone ahead with the originally scheduled time a week ago today, we surely would not have had nearly as much concrete information as we have today. Even looking back at the slide deck that we've been updating over the last couple of days, it surely, it has changed enormously, I think, in the last week. And so I think as we've been doing for the last few months with this webinar, the place we want to start is with the timeline. And while there is an entire year stretched out ahead of us, an entire Congress, an entire administration, I think as you can see from this slide, most of our focus is on what happens between today, and we'll talk a little bit about what's happened over the last week, but primarily what happens between today and the end of the federal fiscal year. And I think as this slide has evolved month by month, we have seen more and more items really sort of being punted and really piling up at the end of the fiscal year. And so I think we're going to start today by looking back a little bit at what happened over the last week. My colleague Jen Taylor will talk a little bit about the Senate debate and where we stand and what we think might come next. And then we will talk about health center funding specifically the health centers funding cliff and the broader primary care funding cliff that's set to take place at the end of September with the expiration of any number of different funding streams that you can see demonstrated on this slide. And then I think we'll talk a little bit more broadly about where Congress is headed, not just on those items, but in general with regard to the ACA, the future of the healthcare system and the marketplaces, as well as a handful of especially interesting programs to health centers, including 340B. I just want to underscore, and I know that the advocacy team will really dig into this, but on this timeline, I think the blue really represents us passing the ball back to you as advocates, where the ball being Congress, and we're sending them home. We've had enough of them here in Washington, and you have a real opportunity, I think, over the next month with Congress back in the district, back in the state, with Health Center Week coming up, to really connect one-to-one with your members of Congress, with their state and district staffs, with their DC staffs who are traveling out. So a lot of our talk today, I think, is going to be about National Health Center Week and about those opportunities. But given how much is there in the orange, I think it's really critical that we take full advantage of the time that we have in the blue with members of Congress there. And then, of course, one of the big questions, will this health care bill come back? When will it, if it comes back, when will it come back? How will we know that things are over? I think our overall take is that they have certainly extinguished any number of options at this point, but, you know, not to be all Game of Thrones about it, but what is dead may never die here, and I think we may see this resurrect somewhat over the next couple of months. So with that, I do want to turn it over to Jen, and we are going to talk about what happened in the Senate last week. She was up all night, I think, on Thursday night, and has probably finally caught up on her rest and is ready to explain. So Jen?
Good afternoon, everyone. Thanks for joining us. I will try to summarize all of the drama and uncertainty and ups and downs of the last week in 2 short slides, but really wanted to just kind of highlight mostly for you, I think, what key lessons learned for us. There's a couple of things. I don't think we have to go point by point through everything that happened. I'm guessing many of you on this webinar are well versed in, you know, all of the will they, won't they get the votes. And we all know at the end of the day, the bill has at least temporarily been put on hold because they were not ultimately able to come up with 50 votes. So I don't think we need to recap everything that happened, but I wanted to highlight at least 3 key votes that I think are worth paying some attention to that really help us understand where senators are thinking and what that might lead to in the months ahead. So as you know, the Senate brought up, underlying all of the conversation last week, the House bill. So that was the starting point for all conversation, and then they offered a series of amendments to try to see if they were to substitute the language of the House bill with something else, could they get to a place of at least consensus for 50 members of the Senate. So remember, when they're working under reconciliation rules, I think you all probably have learned a lot about that this year. They do not need 60-vote majority. They need simply 50 votes, with Vice President Pence being available to break a tie. We did see that happen in the first motion to get this entire conversation started, something called a motion to proceed. Again, you probably never thought you'd be learning about that last week, but I'm certain you know that they, weren't even sure if they'd be able to get enough votes to consider the bill. They did ultimately get 50 votes, and then Vice President Pence did cast that deciding vote, which sent them into several fast and furious days of offering amendments, making changes, constant negotiations in an attempt to try to get to a place of 50. So the first big amendment that was offered was this repeal and delay strategy. This is something that was an amendment offered that would have repealed major provisions of the Affordable Care Act. Remember that under the reconciliation rules, they can only do things that are budget related. They can't simply make policy changes. So at no time really was every provision of the Affordable Care Act on the table. There are certain things they just can't do. But they did, make an attempt to really repeal significant portions, the individual and employer mandates, Medicaid expansion, things that I know a lot of people on this call care about, and said, if we can't get consensus on how to get to a replacement plan, can senators at least agree that we'll move forward with a repeal, We'll put it into a delay so it wouldn't go into effect for 2 years, and we'll give ourselves time to come back to the table and discuss a better way forward. I think one interesting thing of note is that they voted on this basically identical bill back in 2015. At that time, the only current senator who voted no against it was Senator Collins from Maine. She once again voted against this amendment, but she was joined by 6 of her colleagues who previously had voted for essentially the same package in 2015, and that surprised some folks, but I think was really an indication that the conversation has changed. Many of these senators have gone on record and talked with advocates like you back home, hearing their concerns and knowing that they were afraid of what would happen and the uncertainty if you repealed the Affordable Care Act with no plan in place. And they went on the record and said they wouldn't do that. And several of them followed through when there was an opportunity to vote for just a clean repeal, as they call it, and a delay. The vote failed 45 to 55. And I've listed here, it was all Democrats and then 7 Republican senators voting against. I think it's particularly useful for those of you who live in these states to keep an eye on what your senators did this time around. We certainly may be seeing proposals in the future, and it'll be helpful for knowing how they're thinking about this in the months ahead. The second major amendment that they considered was the Better Care Reconciliation Act, the BCRA. That was actually the Senate bill that they had spent really the last 2 months working together to see if they could find some sort of compromise. It would have also repealed key ACA provisions, made significant Medicaid changes, including changing the program to a per capita cap structure, which we've spent a lot of time on these webinars talking about over the last month. They did put in some sweeteners to kind of try to entice people to vote for this package, including at the end they added an additional $45 billion in opioid funding. They tried to get at some state flexibility, allowing insurers to sell cheaper, narrower health plans within the marketplaces. And ultimately, as you know, this attempt also failed, actually by an even wider margin, only garnering 43 votes with 57 no's against. And you can see, I think something interesting there is there is certainly overlap. Senators Collins and Murkowski voted no for all of these amendments, and in fact the original motion to proceed to the bill. But other senators kind of came and went depending on the amendment. And you can see this is not the same group of people who voted no on the first one. People had very different reasons at times for which amendments they supported and which they didn't. And I think, again, that's all going to be useful information for us as advocates in the months ahead. The last attempt, which I actually think was a very smart attempt by Senate leadership to see, okay, if we can't get consensus on just the repeal and we can't consensus on our alternative package, what if we just strip this down to the most basic pieces of the Affordable Care Act that there was agreement on repealing, though they did end up adding in a couple of pieces to that. So they said individual and employer mandates are unpopular, they would repeal those. What if they repeal the medical device tax, which actually has some bipartisan support? They did include an attempt to defund Planned Parenthood from the Medicaid program for 1 year. Some expansion of 1332 waivers, which is, again, providing flexibility in the private insurance marketplace, in the individual marketplace, excuse me. And they raised HSA limits, which is a pretty popular, particularly among conservatives. And ultimately, this attempt also failed. I think this is the one that probably people are most familiar with in terms of John McCain coming in late to the vote and deciding ultimately that he couldn't support it. So Senators McCain, Murkowski, and Collins all voting against left them 1 vote shy of being able to move forward at this time. I think, you know, one important takeaway from this is that while we're, you know, I think John made the point, I don't watch Game of Thrones, but I'm sure you eloquently made the point that this bill is still actually alive while essentially in hiatus right now. We had several questions from folks at the end of the bill who were wonky and watching at 2 in the morning like me, that Mr. McConnell actually sent the bill back to the Senate calendar, and what does that mean? That is not a surprise. What that's saying is ultimately all of the amendments failed and they knew they didn't have a path forward for this bill, but the underlying reconciliation bill that they were using still is essentially alive and could be utilized if they were able to find a way forward for some package of health care policy. I think we're going to talk a little bit today around the edges of what that might be, though I think we're really not going to know more for probably several more weeks if there's really any energy emerging around an alternative plan that has not yet been considered. And in fact, Senator McConnell himself at the end of debate said it is time to move on. So we are anticipating that, again, as this conversation continues, it's certainly not done yet. The iteration of this bill that we've been thinking about for the last several months, since January really, it seems clear at this point that there is no path forward. That said, I think several of you have heard about new potential proposals emerging, one of whom is the Graham-Cassidy bill. I think now you could probably call it Graham, Cassidy, and Heller, named for the senators from South Carolina, Louisiana, and now Nevada, who are interested in, again, trying to find a pathway forward despite the recent failed amendments. I'm not going to get too far into the weeds on this proposal today because, in all honesty, this is something that's still evolving. I know it's gotten a lot of media attention because the senators have been back at the White House kind of working through potential components of this plan and trying to, again, get momentum back on track. Essentially, this plan really relies on trying to change the way that federal funding currently goes to states and currently goes to patients who are purchasing or customers who are purchasing plans in the marketplaces, and instead turn it into essentially a block grant structure. It's playing to this idea, again, that maximum state flexibility is the way to move forward, and that while it would allow states to decide what they think is best for their state, we also think that at the end of the day there would be very serious cuts in federal funding that would still put states in a difficult place for trying to cover the populations they currently cover, to really provide the same quality care that they're doing in the Medicaid space right now. So we do have concerns, but again, this bill is not fully fleshed out. They're still talking through it. If you are represented by one of these senators, or you get a question from your senators or representatives about this bill and about how it would impact health centers, let us know. We're happy to talk that through and get you the information we do have and stay in touch as we move ahead. But for now, I think really what this points to is that there is still energy around trying to find a way forward. There is still a school of thought that Republicans can somehow find a place of consensus themselves. That would be something like a Graham-Cassidy bill. But there's really an emerging school of thought that says now is time for a bipartisan effort, really looking how do you address immediate concerns that exist on the states, on the ground right now, things like market stabilization. There are places in the Affordable Care Act where there are challenges, there are problems that need to be solved. There's actually a group that's evolved calling themselves the Problem Solvers Caucus out of the House. Michaela's going to talk a little bit more about what they're working on. But I think we're going to continue to see new proposals spring forward. There is real need for improvements in our healthcare system. I don't think anyone doubts that. I think really what we're hoping to see in the weeks ahead is potentially some bipartisan consensus about ways they can really be helpful in supporting both health centers, other providers, and patients on the ground. So again, if you have questions, I know there's a lot that's been in the media the last couple of weeks, and a lot of it seems very confusing. You guys have done a great job staying on top of it, being incredible advocates for us and for health centers. I think I want you also to take one moment before we move on to the advocacy tips to congratulate yourselves on a job really well done. Health centers here really spent a lot of time focusing on the Medicaid program. There were many iterations of this bill that were extremely concerning from a Medicaid perspective, big cuts. I think the CBO scored every version of this bill, and we saw coverage losses ranging from 16 million people to 32 million people. It was kind of all across the board. And every time I think you guys stood up and said, this kind of cuts in Medicaid cannot move forward. We saw advocates, senior advocates, disabilities advocates, health center advocates really join together and say, Medicaid is an important program and we're going to fight for it. And that's not something that necessarily everybody saw coming. Medicaid has long been seen as a place where you could make cuts and there wouldn't be a strong advocacy voice. I'm really proud of the work that health centers did to say that's not the case. And I look forward to working with you again throughout the rest of this year to make sure we continue to remind people about the importance of Medicaid. With that, I'm going to turn it over to Amanda, who's going to talk you through some advocacy tips.
Thanks, Jen. And I would just echo, you know what, it's been a heck of a year so far, and we have a marathon still to go. But I would just really applaud everybody for staying committed and strident and engaged on easily one of the most critical issues to health centers and to our patients. And so it's not over. You know, this is going to continue to arise, but I think we should all be excited and proud of what the outcome was the end of last week. So thank you, everybody, for your awesome advocacy. That being said, our work is never finished in terms of our advocacy, and in this space in particular, there are some things that I would really like for folks to do as we head into the August congressional recess and National Health Center Week season, and just generally speaking, I think greater access to members of Congress and to all elected officials. So in the context of Congress and in speaking to what Jen just covered on this latest update, the one thing I want everybody to do is make sure you're aware of how your members of Congress voted on whatever iteration they were given in terms of repeal and replace. And so in the House, that would have been a vote way back in May, and most recently, obviously, in the Senate. But familiarizing yourself with how they voted, and then from there, being able to appropriately respond to them. So the first thing is to know how they voted. The second thing that you want to do in terms of your homework, hopefully everybody already did this for the Policy and Issues Forum, but if you haven't, you really want to make sure that you complete your Medicaid impact assessment and take advantage of the CLIF estimator tool. Both of those things are going to help you to tell the story of how both of these issues impact your health center on the ground locally and your community. So once you know how your member of Congress voted and you've taken advantage of those assessment and estimator tools, we really want you guys to be leveraging National Health Center Week to deliver the health center message in the most timely and up-to-date way possible. And so are you going to say thank you to your member of Congress for voting in opposition to, you know, the proposals for repeal and replace of Medicaid? If they voted in favor of seeing those items go through, what education are you able to do and can you do to make sure that they not only understand what that means globally to the health center program, but also to make the connection for them in terms of what that local impact would look like? And then the final piece is to make sure you're making an ask. And so whether that's asking them for swift action, and we'll get into this, asking them for swift action to correct the primary care funding cliff and the health center funding cliff, or to be sure that you are talking to them about the impact of what a repeal and replace of Medicaid would look like to your health center and to the patients that you're serving. The point is to do your homework ahead of time so that as you're having these conversations, you are completely armed with all of the information to be educated and confident in the message that you're delivering. So you've got plenty of time to do that. We have wonderful tools and resources available to you on the Health Center Advocacy site and on the Health Center Week site. So we will make sure to go through those web links to get you guys queued up later on in the webinar, but just again want to flag how important it is to make sure that you're taking the time to educate yourself, to do your homework, to use those assessment tools to be able to effectively deliver that message during National Health Center Week. I think from here, we are going to segue on to a discussion about the Health Center funding cliff, and so I will turn it over to Oliver and John to get you guys up to speed on that front.
Great, thank you, Amanda. And I just want to set up Oliver here because I think, you know, even as all of this work has been going on around health reform, around potential repeal and replace of the ACA and the Medicaid changes that have been front burner, our goal, and to be frank, our challenge has been to break through with Congress on the urgency of fixing the health center funding cliff once again. We do have that issue. It's a major issue, and it's coming up here very shortly. And so as we're going into August, Oliver's going to fill you in on the details, but as we go into August, and we have some tools and alerts ready to go for you as you go into those conversations with your members of Congress to really raise the urgency on this issue. So, Oliver, take it away.
Thanks for the intro, John. So as John mentioned, there are a litany of issues that have to be worked out before the end of the federal fiscal year. That's September 30th. Our cliff is one of them, but there are actually roughly 22 other issues that have to be worked out. So as you guys were fighting and tweeting and calling on the BCRA and healthcare, pushing back healthcare repeal in the Senate, the House is actually moving forward with one of its 12 appropriations bills, which is what they have to do to keep the federal government open. They have to pass all 12 to keep the federal government open by the end of the federal fiscal year. And so they're working on the Labor, Health, and Human Services Appropriations Bill, and that bill passed the Appropriations Committee on the 19th of July. So we were all wrapped up in pushing back on health care reform and repeal, but the House is moving along and trying to push forward in its budget process and appropriations process to keep the federal government open. And so they passed a $157 billion bill that is extremely important to health centers and many of the programs that our patients actually use into the health care safety net. And so that bill is dedicated to a number of things, including HRSA funding, our Section 330 grants, our discretionary Section 330 grants, biomedical research in combating the opioid epidemic, and also expanding the healthcare workforce and developing loan repayment programs. So think of nursing workforce and programs that actually help us recruit and retain talented staff. And so the bill also provided $100 million for the FTCA Judgment Fund that protects our volunteers at health centers and also provides liability insurance for health service employees. Secondly, the bill also provided $15 million and what would be known as the Health Center Audit, Compliance, and Oversight Office within HRSA. This would be a new office that would be established to audit each individual health center at least once every 5 years. Also, the bill provided, well, while it was good for health centers, it provided $1.5 billion, which is flat funding for our discretionary dollars, our discretionary 330 dollars. It was also pretty bad for other healthcare safety net programs, and there were broad cuts across the board. The bill provided a $398 million cut at HRSA. It cut the Department of Health and Human Services by $542 million and cut SAMHSA, that's the Substance Abuse and Mental Health Services Administration, by $306 million. And so even though there was largely positive news for health centers, and that's really a testament to the great work that you all have done this year to get members of Congress to sign into the annual health center funding letter. That's the internal process where members of Congress send around letters and urge their colleagues to support different causes. There were broad cuts in the Labor, Health, and Human Services Appropriations Bill that passed earlier in July. And so on the workforce front in that bill, there were also some cuts. The Centers of Excellence program, which is a diversity training initiative, suffered a $12 million cut. And the HCOP program, that's the Health Careers Opportunity Program, which helps recruit minority health professionals, was actually slashed from the budget altogether. So while we were pushing on health care, the House is moving forward in its budget program. And so that bill is actually pending right now and has not been brought to the floor for a vote. We do expect that because the House has only passed 4 of the 12 appropriations bills, and because the legislative calendar is so full right now, that odds are they'll be moving forward and trying to pass a short-term continuing resolution, which will give them more time to craft the deal and find a long-term solution to providing funding for health centers and the healthcare safety net and keeping the federal government open. And so I also want to talk about our mandatory dollars as well. And so, as you guys know, we still have our cliff that is slated to run out at the end of the federal fiscal year. That's September 30th. And so along with the Health Centers Fund, the National Health Service Corps, and also the Teaching Health Centers Program, along with McD, CHIP, and a whole host of other extenders also expire at the end of the federal fiscal year. And so we've been working and pushing and working with leadership in both the House and the Senate to make sure that they understand the importance of dedicated and reliable health center funding that is at least 5 years. And we're hoping for a broad appropriations package that provides dedicated and reliable funding for health centers. And so with that, we're working with a number of other advocacy organizations that also support CHIP and McD and Medicare, and also a broad, strong healthcare safety net. And so we're working with members of Congress to make sure that our priorities are fulfilled and that there's reliable and dedicated funding for health centers across the board. So And so speaking of that, we've actually had a number of you all come to Washington, D.C., not only to talk about the impacts of what BCRA means for Medicaid, but to talk about the importance of keeping health center funding whole and keeping the health center safety net strong. And so Mike Holmes, he's one of NAC's board members from Minnesota. He came and testified before the House Energy and Commerce Committee, and he talked about the importance of both the CHIP program and the Health Centers Fund. And so there you can see some of the top-line highlights that he mentioned. He talked about how in medically underserved areas that health centers operate, we're often the only provider of community-based, accessible healthcare services. And so if the cliff were to happen, millions of Americans across the country would be denied essential health services. And so it was important to the committee to really hear that voice from someone who's in the community, who's not based here in Washington, D.C., and who can tell the story of why health centers matter, why the work that we do is so important to the communities we serve, and especially to talk about how in rural areas that lack of access to care because the health center closes or because the cliff happens means that individuals would have to drive 40 or 50 miles out of their way away from home just to receive essential health care services like dental benefits, mental health care services, or vision services that you all provide. And so you can also see that the committee had some broad statements of support for health centers. There's Chairman Walden from Oregon, and he talked a lot about the role that community health centers play in the healthcare system, and also how we deliver care to individuals across the country at a lower cost and deliver quality care at the same time. And so it's not that just we're delivering care to folks who are in urban areas, that we're also delivering quality care to individuals and families who are often in frontier areas who would go without if health centers weren't there filling the gap. And so it's important for you guys to connect the dots here and understand that it's not just the cliff that's slated to happen with our $330, that there are also two other programs that actually hit a cliff as well on September 30th. And the first is the National Health Service Corps. And so actually half of all National Health Service Corps clinicians are serving right now at health centers. And so the National Health Service Corps also had a 2-year extension in MACRA, as did the Teaching Health Centers program and our mandatory 330 fund, the Health Centers Fund. And so that extension is also slated to expire on September 30th as well. And so Mike also talked about the importance of having a strong health center workforce, and that includes expanding the pipeline of individuals who are coming and training at health centers. And that's why we are urging Congress to also extend the Teaching Health Centers Graduate Medical Education Program. And so right now the program has 742 slots in 27 states where individual residents are coming and they're training at health centers. And we consider this the effort for health centers to actually grow their own workforce so that we can bring in folks who are dedicated to the cause of health center and to delivering care in areas that actually have a lack of practitioners. And so there's been a bill that's been introduced in support of teaching health centers, both to extend the program for 3 years and also to expand the number of teaching health center sites that are available. And that bill is H.R. 3994, the Training the Next Generation of Primary Care Doctors, and that was introduced by Representative Kathy McMorris-Rogers and Representative Nikki Tsongas. And right now that bill has over 50 co-sponsors, both Democrats and Republicans. And so we're asking each of you to reach out to your representatives in the House and to ask them to sign on to H.R. 3994 so that we can continue to expand the number of practitioners who want to train and expand their skills and hone their skills at health centers, because research shows that when residents come and they train at health centers, they end up staying in those communities and delivering care for generations to come. So we want to make sure that there's a reliable and dedicated workforce and a pipeline of practitioners who are coming into health centers in the future. So thank you.
All right, Amanda, we're going to turn it back to you for one more advocacy tip.
Thanks so much,
Actually,
guys.
not just a tip, an action step.
Yes, there is a specific action item on this one. Before I dive into that, I just want to say that we sometimes, the advocacy team and the policy team and lots of our colleagues here at NAC live and breathe health center policy every single day, and many of us have been working on the CLIF 2.0 and remember going through this the first time. But to be fair, if folks have questions about health center funding, about how the CLIF works, or you want more information or a 101 just to refresh your memory, we have a lot of really wonderful resources available to support just the basic education around this issue. And of course, if you have any questions or want a refresher from anybody on our team, we're always happy to do that, whether it's a webinar for your health center or for your primary care association. We just want to make sure everybody feels comfortable talking about this, and we never want to take for granted that while we live and breathe this every day, that you all have, the in and out, despite the fact that this is the second round that we're working on this CLIF. So that being said, there's a really important action step that everybody should take immediately today. We have put out a brand new call to action alert on the Health Center Advocacy website, where folks, all advocates and all of your friends and all of your colleagues should send your members of Congress an email and or send them a message across social media on Twitter or Facebook to tell them how important it is to take quick action to fix this CLIF. You heard Oliver speak to the implications for the Health Center program most specifically, and then also these two other programs, the National Health Service Corps and the Teaching Health Centers program, that are so important to health centers and our ability to serve our patients. So there's a very quick and easy way for you to weigh in with your members of Congress. You can go right to the Health Center Advocacy Network website and go to Make the Case and access the alert there. You can also click on Take Action from the same site and access the alert that way. It will take you just a couple of minutes, but it delivers the Health Center message loud and clear, and this is the time. They need to be hearing from us. They need to be hearing from us every angle that we can, both in terms of this action alert and, of course, as I said, using National Health Center Week to deliver our message loud and clear on that front as well. And just one more plug, there are, of course, all the tools and resources to support you, but this is a space where that CLIF estimator tool becomes so important in terms of painting that local picture so that you can speak to, yes, in an overarching way, this equates to a 70% reduction in health center funding for the program, but what does that look like at your health center? And some of you, again, may have done this going back to March for the Policy and Issues Forum. If you haven't looked at that in a while, it's time to dust it off and start having those conversations again in rapid fire with your members of Congress, because the calendar and the clock is ticking, and we've got to get this done to make sure that it's taken care of in ample time. So I will stop there and turn it back over to Federal Affairs. I believe Michaela is going to get us up to speed on 340B.
Great. Thanks so much, Amanda. So picking up where we left, where Jen left off earlier in the webinar, as far as where do we go from here, and is there an opportunity for a bipartisan way forward on healthcare, we wanted to spend just a little bit of time talking about the individual market, and specifically, what is the deal with this term that we keep hearing about known as CSRs. And in general, this issue gets pretty wonky pretty quick, but in its most basic form, CSRs, which stand for cost-sharing reductions, are discounts that lower the amount an individual or family must pay for deductibles, co-payments, or co-insurance. It's available for individuals or families between 100 and 250% of the federal poverty level, and those folks must be enrolled in a silver-tiered marketplace plan. So the ACA requires insurers to provide these cost-sharing amounts to individuals eligible for these CSR plans, and in return, the federal government reimburses insurers for these costs. And then lastly, as noted on the slide, the administration currently makes these payments to insurers on a month-to-month basis, and the current year's cost to insurers is estimated at around $7 billion. And I just want to take a moment to highlight this last point, because currently the debate around CSRs is really around whether or not the administration will pay the monthly reimbursement cost to insurers. Without these payments, insurers have signaled that they will either leave the marketplace or need to increase premiums by potentially as much as 20%. In fact, some insurers have already, in the previous months, decided to leave the marketplace due to the lack of certainty around whether or not these payments are going to be made. And coincidentally, the current uncertainty around these payments actually stems back to 2014. Back then, the House, which was Republican-controlled at that time, filed a lawsuit against the Obama administration claiming that Congress never had authorized spending for the CSRs. The courts originally agreed with the House, and the Obama administration went ahead and appealed this decision, which led the court to allow the CSRs to continue until the case is resolved. Currently, that case is not resolved. So the courts have said that while the courts have said that the administration can keep making the payments while the lawsuit is pending, the now Trump administration has repeatedly said that they will potentially stop defending the lawsuit, which would effectively stop these payments. These threats are largely seen as a bargaining chip for trying to pass some version of repeal and replace of the ACA, which actually speaks to this quote that we have listed on the slide here. This is actually just one of many quotes which allude to the bargaining quote/tweets, which allude to the bargaining chip that these payments have become. So that's a little context for this issue. We wanted to highlight just a couple of things to watch this month specifically around the CSRs. First, the administration has hinted that they may make a decision as soon as this week on whether or not they would make the payment for this month. Still no word yet on that, and in reality they have until August 21st when that payment is actually due. Second, insurers have a deadline of August 16th to adjust the rates that they filed earlier this year for their 2018 marketplace plans. So if the payments are not made or they don't have any certainty as to whether or not those payments will be made, insurers can go ahead and increase rates to make up for the loss of reimbursement. And this would just further disrupt the marketplaces and make these plans unaffordable for individuals and families. So now that the Senate does not appear inclined to take up any version of a repeal and replace as was previously discussed, there does appear to be some momentum on the congressional level to fund these CSRs and thereby provide some certainty to insurers. And this would be part of what many are considering one piece of a larger market stabilization effort that appears to be gaining some energy on the Hill. We've seen this first just this week through the newly formed House Problem Solvers Caucus, which Jen mentioned earlier. The caucus has put forward a number of proposals in an effort to stabilize the individual markets, of which funding the CSRs is at the top of the list. They've also included some additional ACA fixes which appear to have bipartisan support and could further provide some stability, included those which you see listed on the slide. And they are creating a federal stability fund for states to use to reduce premiums and other costs for individuals with expensive medical needs, i.e. those with pre-existing conditions, changing the employer mandate to only apply to companies with more than 500 employees, repealing the ACA's medical device tax, and modifying the ACA to make it easier for states to innovate and to sell coverage across lines. In addition, members in the Senate just yesterday indicated that they plan to hold hearings starting potentially the first week in September when they are back from their August recess, and want to further discuss on a bipartisan basis ways in which they can strengthen and stabilize individual markets, which among other issues would include funding these CSRs. So definitely more to come on this issue, and hopefully I didn't complicate or confuse folks further, but certainly if you have any additional questions, don't hesitate to reach out. So switching gears a little bit, we did want to also just briefly touch upon some activity that took place around 340B over the past couple of weeks. Many of you may have seen that in mid-July, the House Energy and Commerce Committee Subcommittee on Oversight and Investigations held a hearing focused on HRSA's oversight of the 340B program. This hearing was largely in response to a letter that the leadership of Energy and Commerce sent to HRSA back in June, expressing some concerns around program management, specifically that the program has grown over the past several years without additional and proportional oversight, a lack of reporting around how the savings from the program are used, as well as concerns around auditing processes. Witnesses at this hearing included a representative from HRSA's Office of Pharmacy Affairs, which oversees the 340B program, as well as representatives from the HHS Office of the Inspector General and the Government Accountability Office, both of whom have made recommendations to HRSA in the past about potential areas for improvement in the program. Overall, at the hearing, there was broad bipartisan support for the mission of the 340B program, including specifically for health centers and other grantees in the program. However, both the subcommittee and the panel of witnesses did express some general concerns over the lack of program transparency, the need for additional oversight. In particular, some concerns were raised around the lack of reporting requirements, how savings from the program are used, the definition of a patient, and other things along that line. In addition, the issue of rising drug costs was also addressed several times, as was a recent CMS proposed rule, which would reduce Medicare Part 340B drug reimbursement for hospitals participating in 340B. I'm going to go into this briefly in just a moment. And overall, you know, throughout this hearing, there was nothing surprising, and in fact, many of the issues that were raised were very similar to issues that were discussed during the last congressional hearing on 340B, which took place in 2015. But again, this just shows that this is an issue that's certainly on Congress's radar and one that we will likely continue to hear more about over the coming months. And as I just mentioned, I also just wanted to touch very briefly upon a recently proposed rule from the administration that, among other things, includes a proposal that would significantly reduce how much 340B eligible hospitals are reimbursed for drugs that they purchase under 340B. This change, if finalized and implemented, would eliminate most of the savings that hospitals can achieve under the 340B program. However, it's important to note that this proposal does not impact health centers because it's limited to Medicare reimbursement to hospital outpatient departments. And I'll also note that at present this is only a proposal and it's currently open for public comment. If you have any questions about this proposed rule or are looking for more information, don't hesitate to reach out to Colleen Myman, our Director of Regulatory Affairs, and certainly anyone on our NAC staff can certainly put you in touch with Colleen. So with that, I will hand it back over to the advocacy team.
Great, thank you so much, Michaela. So now comes the advocacy piece, and we have a lot of work ahead of us in the next few weeks, and really September is going to be a crazy, crazy month. So just a heads up to get prepared for a little bit of craze coming up in the fall, but the good news is that we've got Health Center Week right around the corner, and that's really where most of our advocacy focus is going to be for the next couple of months. So let's get started here. So for folks that haven't heard, maybe you've been living under a rock the last few weeks or months, really. National Health Center Week this year is August 13th to the 19th. The theme is Celebrating America's Health Centers, the Key to Healthier Communities. Now, I want to focus on the theme for a moment just because I want folks to understand why and how we come up with that theme and hopefully how it's valuable to me, or to you, excuse me. So the theme is designed to reflect on the role that health centers play within the greater, bigger picture of the healthcare sector and in reflection of what we're facing in terms of our policy agenda. And so this year, what we're hoping to really hone in on is the value statement around health centers and the fact that we are the key to healthier communities. And hopefully that is a theme that you can use and make your own, but to really speak to that value statement. And it's not just about, you know, how health centers are serving the greater good of our healthcare system. It's also about how you are providing value to your patients, to your communities, to your state, to everyone that touches the health center as a whole. And so we really encourage you guys to be thinking about how can you leverage that theme and plug into that value statement around National Health Center Week. We do have a brand new Health Center Week website. Hopefully many of you have had a chance to go and check it out and take advantage of all the great tools and resources that are available. It's a brand new site, but it's the same address, healthcenterweek.org. But the big thing with National Health Center Week is that it is one of our best advocacy tools. It is one of our best PR and visibility tools. And even better, it is the only time of the year, frankly, where the whole point is to showcase what you all do well and to celebrate the good work of health centers. So the first thing that you should be doing, if you haven't already, and I would again sort of emphasize the importance of posting your events. If you are planning something for National Health Center Week, please make sure that you go and register that event on the Health Center Week website. It's very, very easy. You plug in your information and zip, you're done. The wonderful thing about posting your event information is that that's where many of your elected officials go to try to find out what events they can access, whether it's a member of Congress who's going to be home during the August recess or one of your state and local folks who's just looking for some opportunity to connect with their constituents during the month of August. So please make sure that you post your events up there. The other piece is that we do have sponsorship opportunities. That's the first place that I go to pair health centers with any available sponsorship dollars that I have. So those event posts are very important for a number of different reasons. That's the very first thing that you should be doing. You can even go back and edit your event. For those of you that have done that work already, if you have changes and you want to update the information, you can go back and do that as well. The other thing that I would say, just in terms of reaching out to your elected officials, and as this relates to advocacy, Congress is going to be home for the month of August. They're going to be looking for opportunities, as I said, to be out and around their district and their state and connecting with their constituents. This year, more than ever, we heard from countless, hundreds of congressional offices asking to be paired with local health center events. For those of you that issued your own invitation to them, now is prime time. They are often, members of Congress in particular, are often last-minute Charlies. They will wait until the week before to confirm their participation at Health Center Week events. But I encourage all of you to be persistent in trying to get them there. Check with the DC scheduler, check with the local scheduler. If you can, be as flexible as possible in terms of accommodating their schedule and getting them out to the Health Center. And the whole reason for this, again, going back to the first half of the presentation, is that we really need to take advantage of the month of August and Health Center Week proper to be delivering the National Health Center Week, or delivering the Health Center message, to be talking about the Health Center funding cliff, to be making the connection between why the Medicaid program is so important to the Health Center program and to our patients, and making sure that when they walk away from those events, they are very clear about what's at stake for health centers and the steps that they need to take to make sure that we have the support we need. The other thing about National Health Center Week, could just encourage you guys to be thoughtful about, and again, tying it back to advocacy, we do have focus days within National Health Center Week this year. So Sunday is actually designated as the Elected Officials Day. Of course, we tend to really emphasize connecting with your members of Congress, but frankly, you should be touching base with all of your elected officials, your governors, your state folks, your county officials, local, everyone. And so whether it is Sunday, which again is designated as sort of our Elected Officials Day within National Health Center Week, whether it is that day or throughout the week, please do everything that you can to be connecting with those folks. You can see here on the screen that we have a number of other days. Health Screening Day is on Monday. We're really excited to be showcasing a partnership with the American Cancer Society. For those of you that are working with American Cancer Society folks, local chapters and across your state, would encourage you to sync up with them on both hosting events, but also putting the message out about why preventive care and cancer screenings are so important and what results you've seen in your community and how that partnership is paying off, both in terms of healthcare outcomes, but also in terms of savings to the healthcare system and just quality of life for your folks in your community. As you can see, we've got Public Housing Health Center Day, Healthcare for the Homeless Day, Farm Worker Health Day. One other focus day that I would pull out from here is the Consumer Board Member Day, which is Friday within National Health Center Week. Now, the Consumer Board element of the Health Center program is very unique. There are no other providers out there that have that requirement, that actually engage their consumers to help design and drive the direction and the operations of your health center. And for that reason, we really want to showcase and celebrate that unique element of the Health Center program within National Health Center Week. So for those of you that are going to be hosting events that are geared at recognizing your consumer board members or engaging them in some way, whether it's an open house where your consumer board members may be the ones that are greeting new patients and those within your community, or you're providing some kind of recognition to the contributions that your consumer board members make to your operations, there's a number of different formats for how you can interact. It could even be having one of your consumer board members place a letter to the editor or an opinion editorial about their role and why it is so important and how it is so unique to the Health Center program. But the point is, this is another space where I would encourage everyone to think about how you can educate your policymakers about that unique element and really engage your consumer board members to do that education and to raise that awareness. The final one there you can see is Children's Health Day. These are just a great way and a wonderful opportunity to create an echo chamber around all of the wonderful events and celebrations going on around the country. But certainly each of these link back to our advocacy efforts in terms of thinking through this lens around how you can tell the health center story, what that local impact looks like, and how you can raise awareness about what actions Congress needs to take in order to ensure that health centers can continue to fulfill their mission and care for their patients. I am going to turn the mic over to my colleague, Dorian Wanzer, who's going to get you guys up to speed, again, in the Health Center Week lens, but around how to engage the media and social media and a few other spaces. Dorian?
Sure. Hi, everyone. I hope you are doing well. I I'm just going to speak on a few things. I know we have a few minutes left, so I'll try to go quickly. But as Amanda said, National Health Center Week is an opportunity to deliver our message as well as a celebration. So we have the entire week to spread the word and make the case for health centers and why they're vital to communities across the country. So engaging the media is key. It's almost second to actually having an elected official come to your National Health Center Week events. So if you visit the Health Center Week website and you access our tools page, you can see that there's a media toolkit. We've got templates for you to be able to submit press releases, letters to the editor, and op-eds. And you're not just limited to, just the newspaper. We encourage you to get creative. If you have a relationship with somebody who's on a local radio station or a blogger, or you have a connection to get on TV, we would encourage you to do that as well. So definitely be sure to engage the media during Health Center Week, and please let us know. You can either share that on social media, you can email one of us on the advocacy team, or grassroots@nac.com, but we'd like to be able to have access to anything that comes out in the media so we can also share it on our channels and on our website. Moving forward to social media and getting online during National Health Center Week, as you know, it's a huge week for us to be on Twitter and on Facebook showing, the great work that health centers do. So please, please, please share pictures of your events. Please be sure to, take videos if you can and share those as well. We have some really, really great focus day images that are going to be coming out during Health Center Week, so those will be available on social media, and we encourage you to share those as well. I feel like folks will really like them, and they'll do pretty well online. And then as you're promoting your events and all of that, tag your elected officials. If you've got somebody who's coming to your health center, find out what their username is on Twitter or on Facebook, and be sure to mention them so that, who knows, they might share that post and it could reach an even wider audience. But when you are posting on social media, please be sure to use the hashtags, the official hashtag, which is right here on the screen, National Health, or NHCW17, and then, of course, value CHCs. Currently, the National Health Center Week 17 hashtag already has over 1 million impressions. Last year, we got about 30 million, so, put that in perspective, and please continue to use it. And then Value CHCs continues to do well. We've made quite a splash on social media there using that, so continue to do so. We definitely want you to just keep up the momentum. Be sure to say thank you. Thank you to the folks that come to your events, to sponsors, to any media outlets that showcase what you're doing, and make sure that you follow up with folks. If you publicized an event and really promoted it, be sure to let people know how the event went and what happened. You can do that by posting pictures, by sending an email blast, a number of things, but be sure to just, say thank you for the support, because typically health centers get a lot during the week and throughout the month. Also, please participate in the National Health Center Week Picture and Video Contest. The picture contest is sponsored by Pfizer Rx Pathways, and the video contest is sponsored by Athena Health. The submission period is opened. It opened yesterday, and you can submit pictures and videos until August 31st. So please be sure to do that. Get creative. Remember the theme, and incorporate that into what you submit. We will be updating you via email and online about what the rules and what to expect for the contest, but you can go to the Health Center Week website and kind of get all the information that you need to know. If you have questions, feel free to reach out to one of us. So in terms of action steps, National Health Center Week is a great time to continue to engage and try to recruit advocates. As a health center advocate or as an individual, you can ask your friends and family to take action. They can do that by signing up as an advocate on hdadvocacy.org. They could also recruit other advocates. So after they've signed up, they'll get a personal tracking link which they can share, and that will direct other people to be able to sign up as an advocate. And then also just sharing their health center story and what health centers mean to them. You can do that on the HC Advocacy website, on the Health Center Week website, or you can share it online and be sure to use the hashtag ValueCHCs. Another thing that you can, individuals can also do is join the National Health Center Week Thunderclap, which is also on social media. It is on our website. It's the pin post, but it allows you to show your support for health centers a week before Health Center Week, so we can have a unified voice and all share why we value CHCs. So be sure to do that as well. Just some resources. If you visit hcadvocacy.org, you will see front and center where you can make the case for health centers. It will have the new action step, which is listed right there. You can also access our funding cliff estimator and our Medicaid fact sheet. So I would encourage you to visit that. It's on there, and it will also be shared on social media. Other resources, which I'm not going to go through for the sake of time, are all listed here, but hcadvocacy.org/make the case. You can find all the tools that you need to take action and to reach out to your members of Congress to fix the cliff. The next Policy and Advocacy Update webinar is going to be on September 13th at 3:30 p.m., so save the date for that. You can go to hcadvocacy.org to register. Sorry, I think the link is wrong here, but either way, if you go to hcadvocacy.org and you click on events, you should be able to see the next Policy and Advocacy webinar and sign up there. And then if you happen to have missed anything about National Health Center Week, whether it was the kickoff webinar or the picture and video contest webinar, you can access those as well on hcadvocacy.org/past events. And I'm going to turn it over to Amanda if there are any questions. But if you have any questions about anything in regards to media, social media, Health Center Week, please do not hesitate. Once again, grassroots@nac.com. Thank you.
Thanks, Dorian. Yes, I think we do have a few questions, and Alex and Elizabeth on the advocacy team I know are paying close attention to that. But just to be clear, we've got some really specific marching orders here. The first order of business is to take action on that cliff action alert. As you heard from Oliver, the clock is ticking, and so the more that we can raise the sort of din around what is at stake in terms of the health center funding cliff, the better. So make sure you go ahead and go to take action on hcadvocacy.org, take action and send your message, and then of course lots to do on the Health Center Week front. So let me stop there, and Alex, do we have some questions that have come in? Okay, it looks like we do. I'm going to let Alex off the hook because the technology is never going to cooperate with us just the way that we would like. But I know that our friend Terry, who is joining us on the webinar from Michigan today, asked a really important question. He's wondering what suggestions we have in terms of how advocates should speak to their House reps who voted no on the House bill. And in his case, there are some folks that are still intending to support full repeal without replacement. And so his question is, how do you have that conversation? What is it that you should be saying to those members of Congress, and what is the tone? So I'm going to let John chime in, and I may add something to it, but I'll start with Federal Affairs since they are working with Congress on a day-to-day. John?
So thank you, Amanda, and thank you, Terry, for a great question. I think Terry's question in particular illustrates, I think, that the value of that slide going back a little ways about doing your homework before you have a conversation with your member of Congress. Especially what Terry notes is that he had a member who voted no on the House bill, which generally was the position that we agreed with, and yet his member voted no for a different reason perhaps than we would have encouraged a member to vote no. And so in his case, he has a member who voted no in some sense because the bill did not go far enough in repealing the Affordable Care Act. I think in that case, there is a point at which, at least on these issues, you know, you're better off at this point in the year pivoting that conversation to the cliff issue and to really digging in specifically on sort of the bipartisan nature of health centers, the local value of your health center, the fact that this federal policy, which is up for debate over the next couple of months as opposed to the last couple of months, is really what's sort of helping shape your future and helping really determining and hanging in the balance what's going on with the health center there. So I think in the case of the larger amount of House members and senators who voted no on these proposals, most of them did so because they shared some of the same concerns that we'd expressed about these proposals in terms of the impact on low-income populations, the impact on the Medicaid program itself, and the impact on providers like health centers who serve those populations. And so I think in the case of most members of Congress who voted no, I think a thank you and a discussion is in order of sort of how they see things moving forward, what you can do to be helpful to them as they continue with these questions. Because I think what we've tried to make clear is healthcare never really goes away as an issue on Capitol Hill, in state legislatures and governor's offices. For policymakers around the country, this is never a problem that they're going to reach the end of. And so it is always important, I think, with those folks to continue to stay engaged no matter what position your member is coming from. But in Terry's very specific case, I think at this stage in the debate, you're better off pivoting towards the cliff. Amanda, I'll defer to you on any other, advice you've got.
No, I think that covers it. The only other thing that I'd add is that, there are folks out there, and certainly in my experience in advocating for health centers, even the most strident of those who oppose, maybe some of the things that we believe so strongly in, over time, we've made them into health center supporters. And so while you may not get them to agree with everything that you would like them to, helping them to understand, and I think approaching the conversation in the context of education and potential impact, and less about, it shouldn't be about the politics. It should be about, what does this policy look like for your health center? What are you doing really, really well? Here's another one where homework is really important. You need to know who you're speaking with. What are the things that matter to them? And so I think John is right, pivoting back at this point, given everything that's going on and where we are on the calendar, pivoting the conversation back to the primary care funding cliff and to the health center funding cliff is absolutely where you should be going. But I think the way that you make that case is by figuring out what's going to resonate with that particular person and making them into a health center champion. Don't worry about the rest of it. Just make sure that they understand what's important to you, what the impact looks like for your health center and your community, and then you keep pushing and advocating from there. So we have another question actually from Terry. He's got some great ones today. The next one is, do we have any suggestions? Oops, sorry. It's on the budget. The last couple of years, we have generally moved from one continuous resolution to another. Any thoughts on how we believe this budget cycle will be different, given the tension in both chambers and with the administration? John, you guys want to take that one on?
Sure. I'll also ask Oliver to pitch in here, but I think it's a great question. And again, Terry's really been observant, I think, of the process here. I think in the near term, unfortunately, I don't think we have a huge level of optimism that Congress is going to change when it comes to sort of this piece by piece, kick the can down the road approach to these budget issues. Now, that being said, I think that we are in a really good position to make the case as to why there is a detrimental impact to that. They keep doing this, and our funding is, stays whole as it's kicked down the road. But in terms of your ability to look into the future, I think we're often making the argument that that really is an impediment to health centers. So, Oliver, anything else you would add?
No, that's a really good answer. I would say the other thing is that, as they go forward and talk about having these redo of these sort of bipartisan and bicameral budget deals, it's important to really reach out once again and make sure that our legislators and supporters know that health centers are important. It's not just about kicking the can down the road 3 months or 6 months or 2 years and giving us short-term extensions, but making sure that, that Congress knows that health centers can't recruit or retain talent, that kicking the can down the road 3 months or 6 months actually impacts our programs and our ability to operate, to sign leases, to get loans from banks. And so that's part of the story that we want you all to tell this summer during Health Center Week and as Congress returns from the recess, and saying that short-term deals, even though they're good for keeping the government open, don't actually help health centers in the long run, that we need reliable and dedicated funding for at least 5 years.
Awesome. Thanks, you guys. Well, I think that the technology is working. Alex, do we have some more questions?
Yeah, we do. We have several. I'm going to start with a couple of questions we have on health center funding. First of all, we got a couple questions asking Oliver, I think, to kind of repeat the cuts that he mentioned, or the cliff cuts specifically about health centers, and then also the workforce programs, and then for us to point them to any resources we have on those issues as well.
Sure. So I think you guys had some questions about part of the Labor, Health, and Human Services bill that passed the House Appropriations Committee. And this is partially related to the last question about what's going to happen with the short-term budget deal. Because Congress has so many things on their plate right now, and they still have to pass all 12 appropriations bills, the likelihood of that appropriations bill passing that I discussed earlier is actually very rare. I think from a macro perspective, you should be once again reinforcing that we need reliable and dedicated funding that's longer than, say, a short-term resolution of just, continuing resolution of just 3 months or 6 months or 1 year. That 5 years is best for health centers, and that the programs that we use and operate, whether it's the Teaching Health Centers program or the National Health Service Corps that also face a cliff in September, also need to be extended for at least 5 years.
So, and I'll just pitch in there, I think that we do have some good summaries of what's in that House bill, and we can follow up with those who ask the questions post-webinar. But I think that just to underscore Oliver's point, I think even as Congress is considering these appropriations bills, our best estimate in terms of where funding is going to go for those programs funded through those bills is that they are likely to just stay on autopilot. I think the difference with the health center funding cliff is that it's the if Congress doesn't do anything, it's not like the funding just continues. They actually have to proactively act to extend that health center's fund. If they don't do that, that amounts to a 70% cut to health centers' 330 grants, and that's why, you know, the impact of the cliff is so significant. So they're sort of parallel processes, but, you know, in one case, Congress can sort of fall back on just continuing the government on autopilot. In the other case, they really have to proactively take measures to spend that money going forward with the cliff.
Great, thank you guys. Hopefully a pretty simple question here. It sounds like there's some rumors going around about Congress's recess being delayed and potentially interfering with Health Center Week. Can you guys help clear that up?
Sure. So Congress did, so a couple of things. First of all, the House is already in recess. They are home. We've sent them back to you all. Do with them what you will. But the Senate, before the bill went through debate in the Senate, they did extend the Senate session for 2 weeks. Those 2 weeks are this current week that we're in, as well as next week. Now that the healthcare piece is off the docket for the Senate, it does seem likely that they will not stay here in D.C. through all of next week. They have some nominations they're working on, a defense bill, some other pieces, but our best bet is that the senators will be back by sort of midweek next week. In either case, luckily, Health Center Week is a week later than usual this year, so it's the 13th to the 19th, and we are barring, you know, very, very unforeseen circumstances that would probably have senators resigning in protest. They will be back, I think, before Health Center Week kicks off officially. I know there are a handful of events scheduled for, you know, next week. If you have senators scheduled to come, I think it's worth double checking on that in terms of next week and confirming, staying in touch with their state staffs. But by and large, the change in the recess and the change in the session should not interfere with Health Center Week.
Yeah, the only thing that I would add to that, guys, is that some of you have heard me say this and my team say this a number of times, but as Health Center Week has grown, it's really turned into Health Center Month. And so we, of course, have Health Center Week proper, which, as John said, is the 13th to the 19th, which the wonderful thing about that is we do that deliberately in order to avoid snafus with Congress. Occasionally they do this where they'll, bump their schedule where they stay in Washington a little bit later than normal. But the good news is that this year it shouldn't interfere, and frankly, even if they did get held up, any event in the month of August we really would deem as a National Health Center Week event. And so in terms of your plans and tagging into that national celebration and creating that larger echo chamber around the important role that health centers play, have no fear. You should not be impacted too heavily. And as John said, everyone in the House is home. And so as much as you can, I would just encourage you guys, and frankly, all of those, and not all of them, but the majority of those inquiries that I mentioned came from congressional offices looking to pair up with Health Center Week events. It was very heavily on the House side. So those guys in particular are looking for opportunities back home. So do everything that you can. Take advantage of the entire month. We're excited to see all the great celebrations and activities going on. But don't be, overly concerned with the congressional calendar, because even if they had to stay in Washington, they would still be home on weekends. So there's always a way to get to them. And the last piece I would say is that if for some reason you can't get them out to your health center, I know Dorian mentioned that we have some really excellent local media templates, letters to the editor, and opinion editorials. Now, that is second to having them there in person, but those templates are a fabulous way to get the health center message out there in the community. Congressional members pay attention to local media. They are constantly looking at what their constituents are talking about, what's important to them, and that's one of the first places they go. So a very easy, simple tip on how you can get the message out and make sure that your message is getting to your members of Congress, whether they are showing up in person or not, is to take advantage of those local media templates, make them your own, of course, localize them, but do whatever you can to get those published. It's just another way to make sure that you are speaking to that impact, as I said before. Alex, other questions?
Yeah, so here's a question kind of related to the health center funding cliff. Looks like there's some confusion about funding that came from the Affordable Care Act for health centers. And this person is asking if the funds that health centers received under the Affordable Care Act actually rolled into the health center base grants.
So that's a great question, and in general, just to back up a little bit, when we talk about, when we talk about the health center funding cliff, we are talking about the expiration of those funds that started with the Affordable Care Act. There was a 5-year dedicated pot of money that went to health centers through the ACA, and then once that funding was set to expire in 2015, the MACRA legislation 2 years ago extended that for 2 years. At this point, at the health center level, all of those funds, the combination of the mandatory funds as well as the annual appropriation funds, the Affordable Care Act funds, as well as our traditional funds, all of that together forms total funding for the health centers program, and all of that is currently being used in health centers base grants. So it's not as though there is sort of a separate pot of money, and if you got something from the ACA or you didn't get something from the ACA, you're either on the hook or off the hook for these cuts. The entire $5.1 billion per year that funds the health centers program is essentially distributed in total to all the health centers around the country in the form of their base grants, which of course have grown over the last number of years with expanded services awards and new access points and other pieces. But so the bottom line important takeaway from that is every health center is at risk, regardless of whether you got a new access point over the last number of years, regardless of whether you got a capital award. Every health center is at risk under a scenario where Congress does not extend those funds.
Great, thank you, John. And here is another question about health center funding, kind of talking about short-term and long-term planning. This person says in past meetings with their delegation, health centers have pointed out that it is difficult to get loans and banking support due to the volatility of funding. And so how would you suggest discussing this issue, especially if there is a short-term funding solution that goes on the table?
Yeah, I would keep impressing that same point, making that locally tailored message that you're impacting our day-to-day operations, our ability to get loans, our ability to recruit staff, our ability to plan for expansions and to try and grow into the future and keep serving local populations. That's going to be the most compelling message to members of Congress because, frankly, with so many plates that they're juggling right now and thinking about these big macro problems with not only the CLIF, but with CHIP and McV and Medicare therapy caps and a whole host of other things that also have a cliff at the end of the federal fiscal year in September, sometimes they're not actually aware of the nitty-gritty details of how a cliff would actually impact health centers. So continue to make that message that there are real-world and dire consequences when Congress doesn't act with predictability or when they don't give us an extension of the health centers program and funding that's long enough to actually plan and recruit and try and train the next generation of health center practitioners.
I think that's exactly right. It helps from an advocacy perspective to share those kinds of situations. Obviously, that's a really concerning situation, and feel free to reach out to us directly because for a couple of things. I think we've talked to health centers who are in those kinds of situations where banks and other lenders have expressed concern about the volatility of this funding, and in some cases, without promising anything, we've been able to give some context for those health centers and their lenders. But knowing the specifics of situations like that actually helps us as advocates when we are up on the Hill, and we are almost every day making the case that this funding needs to be extended for a longer period of time so that we have that stability. The more kinds of specific examples we can use, the better our arguments are too. So please don't hesitate to share those kinds of examples if this is impacting your recruiting, if it's impacting your strategic planning, and certainly if it's impacting loans and financing for really high priority items, I'm sure, that would really benefit the community. Those are the kinds of things that members of Congress really need to know. Unfortunately, they've gotten pretty used to the idea that they do all of this stuff at the last minute, or the last minute is the earliest that they'll do it. Our job, I think, over the next couple of months, as much as anything, is to make the case as to what kind of disruptive impact that has when they do these things at the last minute and when they do them on a very short-term basis.
Great, thank you all. And then here is a question about Medicaid. Do you guys anticipate any additional cuts to Medicaid in the budget process, or any cuts to Medicaid in the budget process, knowing that Trump's budget included a large cut? Do we expect the same from Congress?
That's a great question. Actually, one of the things that I think is really important for us to keep an eye on in the year to come is what happens with Medicaid. As I said, I think we're really, really pleased with a successful Medicaid advocacy effort to date and really showing how important Medicaid is. I think Congress will at least be thinking twice before casually looking to Medicaid as a place for cuts. That said, in really tough budget environments right now, any bill that is passed requires an offset, so you have to pay for the policy that you're passing, and there's not a lot of places to go when you're talking about big, big dollar amounts within your federal budget. And so I think, we've seen people historically look to Medicaid as a place to pay for policy changes, even policy changes that are unrelated to Medicaid. I think we will probably continue to see that at least be on the table. One of my nightmare scenarios as somebody who cares equally about 330 funding and Medicaid funding is that we might find ourselves in a situation where we're looking at a bill that would, try to extend the children's health insurance, the CHIP program, try to extend our health centers fund and teaching health centers and National Health Service Corps and MCV and all these programs we care about, and that they would have to find a way to pay for that and be looking to Medicaid as a way to pay for that. So I think we're going to be really vigilant in continuing to say, there are big priorities on the table. There are lots of things that need to get done in the healthcare space, and that Medicaid is not the way to pay for that. That, you know, sort of this robbing Peter to pay Paul argument, but it really is effective when we say you can't just make cuts on one end and to, you know, pay for a problem on another and think that health centers are going to be okay with that, because we're not. So I think that's my charge to advocates, to continue to understand, you know, specifically what Medicaid does at their health center, how many of their patients are covered by Medicaid, the importance of Medicaid, because I think we may be tasked with making those arguments at unexpected times when, you know, Medicaid might find its way right back into the conversation again.
Okay, thanks so much, Jen. And I think we have time for one more question, and we have one here related to the funding cliff. This person says, I'm a little bit confused about the proposed health center fund extension. Do we have a specific bill to fix the cliff? And would this go through the appropriations process, or does it need a separate legislative vehicle?
So that's a terrific question, both parts. Right now, there is not a specific bill that's been introduced. That's for a couple of reasons. I think one is that generally, in order to get bipartisan support on a piece of legislation that is introduced, that bill has to include what people call an offset, or a way to pay for that extension. And because the Health Center Fund extension is quite expensive, it's difficult to put a proposal together, and we tend to not engage in the conversation around an offset. Mostly we see that as Congress's job. So there's not currently a bill that's introduced to rally around. That is something we're working on, but that offset question is difficult. It would go through not the appropriations process, but a potentially separate, a separate process whereby any number of these expiring programs are extended. So as Oliver mentioned, there's some 22 programs that were extended by the MACRA legislation in 2015. And as folks remember from that point, there was in that bill a big underlying vehicle, the so-called doc fix, that all of these extensions rode on. Unfortunately, or fortunately for doctors, they fixed that doc fix on a permanent basis, and so there is no longer that sort of must-pass vehicle underneath. What there is the combination of all of these high priorities, CHIP, community health centers, and the like, that I think taken together, we are expecting will form their own package. At the end of the process, that could end up tagging along with an appropriations bill, and along with all the other things that were on that the first timeline slide, because, you know, Congress, as it gets to the last minute, what they tend to do is sort of pile all of these things together into one package that is easier to move. So it's a perfectly good question. We're working on, you know, a potential introduction of a bill so that we all have something to rally around. But either way, we expect this to go as part of a larger package outside of the appropriations process, but potentially parallel to, that has to happen before the September 30th deadline.
Great, and it looks like we got through most of our questions, and since we only have a couple minutes left, Amanda, you want to wrap it up for us?
That sounds great. Thank you so much, Alex, and everyone on the Federal Affairs and the Advocacy team. If we didn't get to your question for some reason, please know that you can always enter it into the chat box last minute, and we will take those up with you individually best we can. You can always feel free to email or call us at grassroots@nac.com, federalaffairs@nac.org. Or just give us a shout. We love being able to talk with you guys live and in person and or by phone at a bare minimum. So don't be shy. We'd love to hear from you. Thanks again, everybody, for your incredible advocacy. We have had a heck of several months getting us up to just last week. We're really excited about everything that's to come with National Health Center Week, and we are surely counting on all of you, our advocates, to make sure that the Health Center message is delivered loud and clear back home. So good luck, best wishes. We will see many of you in a few weeks at the Community Health Institute, and in the meantime, be in touch if there's anything that we can do to support you. Thanks again, everybody. Have a great day.